Thank you. All right. So recording's going. So on our Smith Pump Company benefit plan this year, I'm going to hit a share screen and share some documents with you. Okay. So this is a summary of benefits and coverages that you're looking at here, and just a few items I really want to touch with. For the most part, this is going to mirror the plan you have, but with a couple of differences in how you go about it. You won't really have an in-network and out-of-network benefit. This is what's called an open access type plan, and Dallas with Claim Doc is going to go into more detail on that in just a minute. But your deductible, before we had what we called a $2,000 family monthly deductible. That is something that not everybody set up to administrate. So we changed the deductible, tried to keep it as similar as we could. So what we have now is a $2,000 individual deductible. That's an annual deductible, and it's $3,000 maximum for a family, and those are annual. So we felt like that is good or better than what you had. The other thing you'll see is that we have a $5,000 maximum out of pocket. You'll see here, and that's the same thing that we had in the past. A couple of other things I just remind you: have a $20 office copayment when you go to the doctor. Specialist is also still $20. Your drug copays have stayed the same. And remember that we've had the Sharks program in. We will have another company this year. It's called Verus, but they have a similar same type of program as Sharks did. So you may be getting a call from Verus, VERUS, in regard to your prescription drugs, especially if you have a specialty drug. You'll want to take their calls and work with them to get those set up. Those save tremendous amounts of money out of your pocket and to your plan on those. Some of those drugs, are very expensive. Let's see. Facilities to the hospital, it's covered at 100% after your deductible. Pre-certification is required. If you don't get pre-certification, there could be a $400 penalty for not pre-certifying. When you pre-certify, it will run those services through a vendor that's called Coral, and Coral will offer you some opportunities to go to direct contracted facilities. And if you choose one of those, it'll pay 100% with no deductible. So that's a benefit that's paid at 100% up front. Second thing is you have Teladoc or telephonic medicine, so you can call Teladoc, get a doctor on the phone. Now it is, if you go for the regular MD, there's no charge for that. But for like mental health and so forth, that's something new that'll be available. So if you need to see a psychologist or psychiatrist, there's a $45 copay. I think one of the biggest things in that area is Teladoc will help get access. We can typically get access to those providers in about 7 days. And from what I'm hearing out in the marketplace, people have a very difficult time even getting in for mental health. So this is meant to, help in that area. All right, so I think we've touched base on most of the high level things. Like I said, the rest of this is going to be pretty much the same kind of benefits you've had before, because we've mirrored the plan except for how we go about networks and access to physicians. So with that, I want to introduce Dallas, who is with Claim Doc, and let's see here. Let me get this set up for you, Dallas.
I can also share my screen of the PowerPoint so that I can go slide by slide.
Do that?
Like. Yeah, we can do that.
All right.
Thank you, Bill. Oh, I think you might need to enable screen sharing for me to do that.
Yeah, give me just a minute here.
No worries.
Find it here. All right, you should have it.
All right. Let me see if I can get that going here. Well, let me know when that starts coming through for y'all.
Yeah, I can see it.
Okay, great. Thank you. So yeah, as Bill mentioned, my name is Dallas Lavelle. I'm with ClaimDoc. So along with the ClaimDoc program, we're here to help you navigate this new reference-based pricing plan option that Bill mentioned. So we'll dive right in to let you know what this is all about. So as we mentioned, reference-based pricing, you may or may not have heard of this already, but what it is, with ClaimDoc, we're providing you a successful RBP and open access program as well. So RBP uses a reference for pricing. What that essentially means is that we're going to use Medicare's allowable as a reference point for reimbursement to providers, and then we add an additional 25% to that, so that we're giving them a fair and reasonable payment, and also some profit margin as well. But we set it at a reference so that we're not your plan's not just paying egregious charges as they go up and up and up. As we all know, medical is getting more and more expensive. So this is a way to tamp that down, and to make sure that providers are still getting paid fairly, but not getting overpaid. So ClaimDoc's claim review and audit program determines that fair and reasonable payment amount, and then we will go through to your plan administrator, ABA, to pay forward from there. So that, again, that reference point is how we price claims. Medicare is the most common. I've already kind of went over that. And it's all to lower that high cost of healthcare. As Bill mentioned, you know, healthcare is always going up, it seems like, so we're here to help bring an end to that. As part of that, we have the open access plan, and this gives you more choice for where you're seen and what providers you choose. There's truly no network. You have a freedom to choose your providers without restrictions or any limitations from the plan. And because of that, all claims are paid at the highest benefit level because there's no in or out of network. Everything is considered in network when we reimburse a provider. So there's no penalties, no benefit reductions if you go to an out-of-network provider, because they truly don't exist with this plan. So as long as your provider submits the claim, then you're only responsible for your patient responsibility. As always, when you see your explanation of benefits, feel free to, we want you to review that and then only pay what's your applicable patient responsibility from there to the provider. And we'll go more into that as we go along too. As part of ClaimDoc, you have access to member advocates. This whole room that I'm in right now is full of them. So you've got these people at your disposal for questions about the new plan. They're all experts on how this works. We work with many different clients who have open access plans with reference-based pricing. So we're well versed in this. You don't have to be an expert. You just come to us, and we have experts here for you that you can lean on. So the new plan provides you with these services. There's no extra cost to you, and we'll help you navigate the plan and assist you with many different things. But the main 4 things are that we'll introduce the plan to your healthcare providers. Chances are they may not be familiar with it either. So that's what we're here for, and we'll reach out to them and educate them on your plan. We'll also help you find a doctor or a facility for your medical treatment and a less costly healthcare provider too. And we'll also help you understand your medical bills. That's what we're here for. If you get a bill that you're confused about and you want us to review it, then feel free to get in touch with the member advocate and send that along, and they'll be able to educate you on that plan and how the claim was processed and things of that nature too. So as I mentioned, reaching out to providers and introducing the plan, educating them on that program is actually called Pave the Way. So you'll hear us say that a lot. It's allowing us to make the introduction and beginning a partnership with your providers that you already have, or any new providers that you want to see. So in some cases, obviously, healthcare providers may not be familiar with the new plan. So that happens pretty often. It's something to expect and anticipate, so we can get ahead of that though. So let us remove that unnecessary stress from your shoulders. You don't need to go out to your providers and try and explain this plan that you just learned about. Lean on ClaimDoc. Let us do that for you. So as part of the program, we're going to contact your provider before you have your first appointment and ensure that they have all the information they need to see you and submit your claims to the plan on your behalf. So you don't have to pay out of pocket or anything of that nature. It's just like normal insurance in that regard. you're going to be seen, and then you're going to pay your patient responsibility after you get your EOB. So as part of that, we ask that you nominate your healthcare providers so that we can reach out to them. This is a formal process, but there's a few different ways that you can do it, and we try and make it as easy as possible to do this. So just all you need to do is complete the nomination form and submit it to ClaimDoc. And there's a few different ways you can actually accomplish that. You can go online. So we have a website, a portal that you can access, and using that PIN, the SP76710, and you don't need to remember all this because it's going to be all published on your benefit booklet and everything as well. And you can also email our member support team, and you can free form that. You don't have to necessarily do the form, although we prefer the form. You can just say, hey, I want to see this provider. We'll collect any additional information that we might need, and then we'll begin that process for you. You can also download the ClaimDoc mobile app. It's all on the Android Play Store. It's on the Apple App Store. You can download that, and then it's the same as the portal essentially. So you can submit nominations that way, or you can just call ClaimDoc. Member advocates will take the information just from you over the phone, establish that one-to-one relationship, and then they'll begin that outreach for you and keep you informed along the way.
Also, Dallas,
yep.
Let me just jump in. We have also put that information on the benefit on that summary that Crystal sent out that needs a signature to come back. So it's got that wording on it and so forth to nominate your physician. If you'll put those on there and get those back as soon as possible, we can still, if you change your mind or need to add or delete a dependent, we can do that through the 22nd. But if you'll get those back and look at those in light of, addresses, phone numbers, emails, everything that's on there. If anything needs to be corrected, please make those corrections so we'll have all your correct data. So when I get ready to start paying claims and things, they can do it correctly for you. Thank you, Dallas.
Yep, thanks, Bill. And then, like I mentioned, a member advocate will be in touch with you along the way throughout the process, making sure that you have the most recent information from their outreach attempts, and ultimately the results of the outreach as well. So let me see. One last thing here is that we do strongly encourage you to submit those providers information in the nomination before your first appointment takes place. This isn't a requirement per se, but it's really highly recommended so that you do have a smooth experience. Obviously, we have a lot of experience in this space with these kinds of situations, and we know that your chances of success are much higher if you do complete a nomination.
And I've already gotten the majority of those back. There's just a handful of employees that haven't completed one or don't have a PCP. So I'm going to send you over the bulk of those today.
Wonderful. Thank you, Crystal.
Mm-hmm.
And if you don't have a PCP, like Crystal mentioned, then we can absolutely help you locate one that fits your needs. And so feel free to connect with a ClaimDoc member advocate and get that started.
And then all doctors that we see on a regular basis, right?
Yep. I highly recommend that. Or ones that you foresee the need for, any specialists, any primary cares, any provider that you see. Yep.
And if there's not enough space on those forms, you can complete multiple. So don't think you're just, writing down one primary and one physician that's a specialist. Use that form as many times as you need.
Yep. Good call. So actually utilizing the plan, once we've completed all these processes and gotten through and we confirm that they're going to submit your claims to the plan, you just go and present your ID card like you normally would and expect to receive care. So the front desk representative will review that card, verify that they can submit claims to the plan. It is called the Smith Pump Health Plan. So when you introduce it, you can tell them that it's self-funded. So that means that it's, it is owned by your employer. So that's really helpful to use that information and to your advantage. That's something that we tell the providers as well when we call. Benefits and eligibility will be verified by Assured Benefits Administrators. That's your third-party administrator. They do the benefits adjudication of your claims and things of that nature, and confirming that you're eligible as well. They'll see the number on the card. They'll know to call that number and get that started and completed on their end from the provider's perspective. And then claims will be submitted to the claim address on the back or the EDI payer ID, which is the electronic form. So they can submit it that way. It's kind of a technical piece, but it's good to know. That's all on the back of the ID card as well. So we also will tell them the same information when we call them. And if the provider does have any additional questions about the plan, doesn't recognize it once you actually get there, have them call ClaimDoc right away, and we can just quickly introduce it again. These kind of scenarios are possible. The only reason is that sometimes when we call, we may speak with the decision maker who says, yep, you know, have them come on in, we'll submit the claim, etc. But then you talk to a front desk person who maybe they were out of the office when we called, or they weren't listening or weren't paying attention when we introduced the information, and then they see it and they completely blank. So those situations happen. That's why we're here for you on the phone. Give us a call, hand your cell phone to the representative, whatever you need to do, or have them just call us, and we'll take care of it from there. That should be a rare occurrence, but it's something to keep in mind. And then after everything's been said and done, after the appointment, make sure you open your mail and communicate with ClaimDoc just to protect yourself from paying more than you owe. So always compare your bill to the explanation of benefits or the EOB that you get from ABA after your claim has been fully processed. This is important because you want to only pay your patient responsibility with this plan. As with all plans, you shouldn't be paying any more than what your EOB actually tells you to. In some cases, a healthcare provider may do what's called a balance bill and send you a balance bill. What means is that they've received that fair and reasonable payment that we discussed from you and from the plan if you have patient responsibility, but they're seeking additional amounts directly from you. Your health plan actually provides you with balance bill defense through ClaimDoc, and that's, again, another free program that we provide as part of your plan. So you are not responsible for ever paying a balance bill in any case. But what happens if you actually get one? Here's the process. So in order to protect you, call ClaimDoc as soon as possible and submit a copy of the bill. We just ask that you capture the whole thing and send it to us. You can even use your phone or however you want to do it. You can scan it and then send that to ClaimDoc for review. We will confirm if it is a balance bill and how to take care of it from there. And then we will ask that you only pay your patient responsibility. As always, this is something that we're going to harp on. Always pay your patient responsibility and nothing more than that. And then we'll send you what's called an authorization form. It requests your signature, and that actually just allows us to initiate your plan-sponsored balance bill defense benefit and reach out on your behalf to your provider and initiate a dispute. The specialist with the balance bill team will take everything from there. They'll contact the provider, understand their position, and then your involvement will be very limited as a member. We only ask that you continue to send us any correspondence you receive related to that balance bill so we can stay on top of everything, and then continue only pay your patient responsibility. Don't pay any balance bills. That's not part of what we want, and it's not something that you should do. So it's a lot of information, but the main takeaways I want to leave you with are that the plan is open access. So you've got complete freedom to choose your healthcare providers, whoever you'd like to see, nominate them, and we'll reach out to them, connect with a member advocate, and ask them any questions you have. Again, the room is full of experts here, so they're going to be willing and able to help you understand the new plan and, you know, take care of your provider nominations as well. And then once you actually receive care and receive an EOB, review that and make sure you're only paying your patient responsibility and don't pay a balance bill. And then open your mail and communicate. Reach out to ClaimDoc if you get a bill for anything more than your patient responsibility, and just keep that open communication with us to ensure that you're getting the best experience out of your plan. Any additional questions? Anything that Bill mentioned, anything that I talked about, we're here and ready to answer.
Questions?
What if you don't have a doctor here in Waco?
The question it was, what if you don't have a doctor and you're in Waco?
Okay.
So regardless of where you're located, excuse me, we'll reach out to those providers wherever the doctor is. You don't have limitations geographically at all. So even if you cross state lines or you go out of the Waco area, those providers are still eligible and they'll submit claims to the plan. So we'll pave the way with whichever provider you have, wherever you are.
You know, another thing you can do, if you want to pick a doctor for your primary care, you could nominate that doctor. You know, you might just check to be sure that that doctor's practice is still taking patients, you know, new patients. And then you can nominate that doctor. So you'll have one set up and ready to go to that's familiar with your plan.
And that's a question that we'll ask too when we pave the way, is if they are taking new patients. And if you haven't done that legwork, then we can tell you if they are or if they're not. And if they're not and you're a new patient, then we can help direct you to a different provider as well.
So is ClaimDoc responsible for the contracted facilities?
Yep, great question. So ClaimDoc does manage the provider relationships, both for folks who are submitting through the open access plan without a contract, which we don't typically require a contract. But if a provider comes to us and they do require a contract, and we've worked out that is actually has to happen, then that's something that we manage the relationship on. Yep.
Oh, I meant the 100% covered direct contracted facilities.
Oh, with Coral?
Those on
Nope.
Coral.
Yep.
Yeah,
That's
those,
with Coral.
those
Yeah.
will be things, if you're getting a surgery, you can call Coral ahead of time. And they can give you some options of contracted facilities ahead of time and depending on what's available through Coral. They may or may not have something available where you want to go. But if it is, you can make use of that. ClaimDoc will handle it then, if not.
And how does ClaimDoc and Coral handle anesthesiologists? I know that seems to be an issue with every insurance company.
So when we, let's say you have a procedure that requires anesthesia, you're going under for whatever it could be, colonoscopy, for example, if they put you under for that. We try and pave the way with each practitioner in the chain. So the anesthesiologist, the actual gastroenterologist in this case, and the facility that's going to be performed at. So we make sure there's understanding on all levels and that they're going to submit the claim to the plan. The anesthesiologists, like you mentioned, cause issues for all insurances because they do like to balance bill too, but we have experience with that and can ensure that they don't try and collect additional amounts, and you're going to be defended against that as well.
One of the things with anesthesiologists on the traditional plans, PPO plans, a lot of times you would have an out-of-network anesthesiologist at a network hospital with a network surgeon, and you didn't have any choice in the matter. A guy shows up at your surgery, and then you find out later they're not in network. That's always been a challenge. I think in this methodology, it's going to really do a lot to clean that up.
You will have some additional protection as of 2022 with the No Surprises Act too in those situations. So as part of that legislation that was passed, then if you go to a location that's considered, in network with the plan, or in case of a lot of the times it's an emergency, you go in and then places like to bill you the full bill charges, even if they did submit the claim. So they can't do that under the No Surprises Act and the EMTALA Act as well, which is the Emergency Medical Treatment Act. So if you are seen as part of a true emergency and you have to undergo procedure, then you can't actually be balance billed, and they are required to submit the claim to the plan in those situations too.
One of the other things that you mentioned was that if someone needs a surgical procedure or something like that, it has to be pre-approved. Dallas, can you talk about that process of how doctors are provided in the names and the rankings for the employee? And it's not just the cheapest doctor that we can find, but it's actually like based on their, their quality and.
So in terms of like a quality evaluation, we will always try and find the highest quality option when it comes to finding a doctor that'll see you for a procedure, surgery, submit your claims. I know that your pre-auth or your pre-certification vendor, they will also require pre-cert for certain situations and scenarios. When we pave the way, we'll tell them about the pre-certification requirements, but they need to ultimately direct those questions to the pre-cert vendor as well, who will be involved.
And so when you get pre-certification, the pre-cert vendor that's involved will get that pre-certification call, and they'll walk through some of that with the employee.
Dallas, when you are traveling and you need to run into a clinic for whatever reason, how does your company handle that?
Great question. We do have a number of relationships with like in case of like an urgent need or an urgent care, we do have a number of relationships with urgent cares across the country already. So we try to account for that as much as possible preemptively. But if you have a really urgent need and it's not quite an emergency, but it needs, you need to go to an urgent care, let us know as soon as possible and we'll do our best to pave the way right there. And then before you're seen, we would take that. If you would call in, then we can ultimately just do that right there and then. So that'd be the ideal circumstance.
Okay, thank you.
You're welcome.
So Dallas, question I have for you, phone call, what does accessibility look like when people call in?
Yeah, so we've got, we are actually always adding member advocates to our phone line as well, folks who are on the inbound line. Right now, look, I can see our stats on our monitors up here, and we actually have answered 93% of calls in less than 30 seconds. So you won't be on hold for any significant amount of time when you call in.
Before we go to an appointment or anything like that, do we have to call them first before scheduling?
I think I heard the question. So the question was, before we go to an appointment, do we need to call before that appointment? You're not required to, so you don't have to, but we do see that there's a higher rate of success if you do. So as soon as you know that there's an appointment, let us know, and then we can pave the way with that provider before the appointment takes place, just to make sure that they're not confused about how your plan how your plan operates when you walk in. You don't want to come in there and show them your card and they say, oh, we don't recognize this plan. Ideally, we can preempt that question and get that out of the way so they do recognize it when you walk in. But ultimately, it's not a requirement, but it's just highly recommended.
So is that even true if it's a doctor that you've already worked with and given them information on the plan?
So folks that ClaimDoc has a pre-existing relationship with. Yes. So we have a number of doctors that are already familiar with ClaimDoc and with other plans that we've worked with in the past. So typically that conversation's a much shorter conversation because we can tell them, hey, it's ClaimDoc again. Here's the new plan. And they're usually they're going to be on board because they've already submitted claims in the past to other plans that we worked with too. So we still want to make sure that we get in touch with them because the name of the plan is different, or it might be with the plan administrator ABA that they haven't worked with in the past. So we do like to make sure that there's just that quick introduction to the plan and that they have understanding.
So the forms that we're collecting from the employees that have the doctor's information for the ones that they're currently using, so y'all will reach out to those and kind of educate them on the plan information. So will they still need to call in before they visit one of those providers?
So if we get those nomination forms, we'll take that information. It'll have the employee's name and their contact info as well. So the process works like this. We'll get the form, it's loaded in our system, and then we reach out to the employee and say, hey, I'm your member advocate. Here's how this is going to work. I'm going to reach out to the providers that you listed, and then we'll name those providers for them to make sure we've got everything and just validate that. And then we'll begin outreach to those providers. And then we come back to the employee and say, hey, here's the results. These providers are going to submit claims to your plan. And if you have an appointment, obviously we'll prioritize those more highly than ones that don't have an appointment listed or an appointment or an urgent need. So make sure if you do have an appointment on the books that you do let us know as well, so we can get those taken care of really quick.
And Dallas, when you say provider, is an organization like Baylor Scott and White that has, a multitude of providers. Would that, have you already established a relationship first with that organization? And should we need somebody else within the year, after March 22nd, need to see another doctor within that organization? Is there going to be a problem getting them approved?
Great question. Yeah, great question. So specifically with Baylor Scott and White, I do know that we have an existing relationship and they've submitted claims
Okay.
to the plan pretty actively. So we do have a number of claims that we've received from them, which is really great for you folks, because I know that they're a big deal, right? So we'll want to make sure with a system of that size that we're reaching as many doctors within the organization as possible to spread the education around. Due to, in my experience with larger systems, we want to proliferate as much as we can throughout the system. So if you have doctors, even with this knowledge that I've given you that the system generally submits claims, make sure you nominate the individuals within the system that we can reach out to.
But doctors can't be added after March 22nd. Should we have?
Oh yeah, this is always available. Pave the Way is
Okay,
throughout the life of your plan. Yep, sorry, you're right.
thank you.
No problem.
So what does that look like? I go to my primary care and I need to go see a specialist. Let's say I go today. I call you guys, or there's an online portal maybe where I can submit the new specialist. You guys start working on that. I mean, is that days, is that weeks, is that months? What does that typically look like on y'all's end?
Yeah, great question. So it will depend largely on the receptiveness of the provider and their ability to, if we don't get them right away, their ability to return our call, and getting through to the actual person who makes the qualified decision. We don't want to necessarily get the answer from the front desk representative who looks at it and says, yeah, this looks great. Because then, later down the road, if someone higher up hasn't seen the information, they may be confused and say, what is this? So it largely, I would say most of the onus is on the provider to actually respond and make sure that they're getting the information and understanding it. I like to say it could take a matter of minutes. We can call, introduce the plan, and they're saying, yep, sounds great. It could take a matter of, and this is the worst case scenario, months. So those situations are when we actually need to get a contract in place if provider's not willing to submit claims just naturally to the plan. So that process, depending on the bureaucracy within the system, can cause that to take a longer time. But we're going to be transparent with you and keep you informed along the way, so you're appraised of exactly what's going on. But the grand majority of them, I would say, are resolved within a week to 2 weeks.
Okay. Do you guys have a preferred list maybe of doctors in Texas? I mean, DFW, Houston, Waco, and Austin is where most of our employees are. If you guys would have a list, I mean, that might make it a little bit easier for you guys, maybe do less work, easier for
Great
everybody.
question.
Just
Yeah,
take a
no, great.
spot.
That's a great question. Yeah. So we have an internal directory of providers that we've reached out to and the folks who are submitting claims. We don't typically like to share a list just because it does limit people when they see the list, and they may not want to deviate from that list because they think that those are the go-tos. So we want people to think creatively and nominate their providers too. We have no problem within taking a bunch of different provider nominations. So feel free to nominate whoever you've got and we'll reach out.
Yeah, I feel like you guys would organically or naturally, if you have a problem provider that's not working with you, say, hey, why don't you go check these guys out? Because you need service right now and not months from now. Okay.
Right. Yep. Good call. So yeah, because we have that back end direct, I would say a directory. It's not, it's not a network, but we have providers who we've talked to and they've said yes. Or even some of your fellow employees have submitted a nomination. We figured out that provider is willing to submit claims, and they've even told us, send us more folks. We've heard that before from providers, and we'll certainly direct folks to there if they have a provider who's not submitting claims or they don't know where to go. We can direct folks there.
Yep. Any tips just in terms of, I mean, maybe orthopedics are always the worst, you break a leg and you got to see an ortho, any like tips like that maybe guide us in the right direction for just, you guys see it, everything, maybe certain tips that you guys can provide.
Yeah, I think the main providers that we see who are usually are more reluctant to submit claims are actually I can't think of a chiropractor. Yeah, I don't know why I was missing. So a lot of chiropractors are actually moving toward not submitting claims to any insurances at all. So they're taking on the folks are just having to submit what's called like a super bill. So they'll give you the bill and then you submit the claim yourself and get reimbursed. So in those situations, we would just reimburse you directly. But in terms of like problematic providers, it's usually, I would say, dermatologists, Not dermatologists. Well, yeah, dermatologists
In
sometimes.
Waco, that's traditionally been a challenge. It's gotten better
Yeah,
recently.
yeah, we've seen progress with that field specifically, but yeah, I think the primary one that I've seen issues with is chiropractors, occasionally dermatologists, not necessarily orthopedics. Let me think what else. Sometimes pediatric providers have need additional help understanding because again, we reimburse using Medicare's allowable plus 25%, and sometimes they're instantly turned off by that because a lot of the pediatric codes that they use aren't on the Medicare schedule. So we have alternative reimbursement methods that we'll educate them about in those cases. And so we can usually bring them on board, but those are the ones that require a little extra touch.
Thank you.
So-
You're welcome. Thank you.
So if it's after hours and say that there's an emergency, you need to go to the doctor, what is the best case scenario with our insurance? What should be done in that situation?
So in terms of if it's after hours and you've got an emergency, go to the nearest emergency room in every circumstance. Because of EMTALA and the No Surprises Act, that emergency room will have to submit that claim to the plan and not balance bill you. So that'd be my recommendation.
So it doesn't matter whether you go to the hospital ER or Premier ER or any of those places, it should all be the same.
Right. Yeah. Regardless of if we've paved the way with that provider or that hospital in the past, then just go to the nearest ER in the case of an emergency.
Now, if it's an emergency is the key word.
Yes.
Some things are not emergencies, but you need to see someone. Probably 70% of the primary care visits can be taken care of at night or on weekends, on holidays through Teladoc. And I personally use Teladoc and have used them quite a bit for simple things. And it is so easy. They usually call me back within 20 or 30 minutes and I have an appointment. I think maybe one time it took me 45 minutes, but probably quicker than I can get it set up and drive and go back home. It's done. So that's an option for you. And then you also have some urgent care centers. I don't know on urgent care centers here in Waco who's open at night, but if any of those, but that's also an option outside of the emergency room. So emergencies at the hospital should be safe for real, life-threatening, serious type events.
Can you resend us all the information on Teladoc?
Yes.
Do we have dental eye insurance?
Question was, do we still have dental and eye insurance?
Do you still have dental and what?
Eye vision.
Eye insurance? That's a Crystal question.
Yes, that open enrollment period is coming up, I think, for June 1st. Chris will have to verify that for me, but right now there are no changes to that. If you've elected previously, we'll send information out in the next couple of months about that open enrollment period.
Thank you.
Mhm.
Any other questions?
I think we're good.
What are the main differences of this plan versus our previous plan? Main changes, really.
The main differences. So I would say that the main differences are, number one, you don't have an in and out of network. You have an open access plan with ClaimDoc. That's the biggest difference. The second difference in this plan is the deductible is slightly different. You had a $2,000 family monthly deductible, and now it's a $2,000 individual, $3,000 family annual deductible. Those are really changed just because most third-party administrators are not set up to administrate the one you had. I think the other thing would be in the Teladoc, we have added mental health coverage under Teladoc, where you can get that telephonically, and that improves your access for that with a $45 copayment at the time of service. Those would be our major changes. And I guess one other would be the administrators change from 90 degrees to ABA, which is assured benefit administrators.
When does our coverage start?
April 1.
So any money spent before then is not already covered.
Well, I think what you're really looking for there, if I understand you correctly, is you want to know if your deductible that's been met this year applies. So we'll get the deductible accumulators from 90 degrees and send those over to Entrust when we get to the end of this month. And then they'll apply those deductible amounts to your new plan. Everything since January 1.
Okay.
Other
I'm looking at,
questions?
I'm looking at the online form. Is that submitted electronically or can we print those out and then email them?
Are you
Are you
talking-
referring to the, go ahead.
Sorry, Alice. Are you talking about the provider form, Oscar?
Yes,
The
ma'am.
nom-
Yep.
Either way, whatever works for you.
Okay.
All right, guys. Well, thank you very much for your time today. My staff and I are always available for questions. You've got your contact information for Claim Doc as well. I'm sorry.
We had one more question in the room. We just,
Okay.
we would like to know about the prescription and how that is going to change and what effects we could see possibly.
Yes. So your prescription provider behind the scenes, we call them a pharmacy benefit manager, is going to change. You had Southern Scripts. You're going to go the same kinds of places to go get your drugs, but that'll go through a company that's called Veris, which is also owned by this third-party administrator, ABA. And then they also will provide the same services that Sharks provides you for specialty drugs. Sharks has been a tremendous help in that. ABA has the same services and program, and it wraps it all up with one provider for our claims payment and our pharmacy.
Do we expect the same cost?
The co-payments are the same. Drug costs can change a little bit through time. So if you have anything that's hitting like a deductible or a co-insurance on some of the higher cost drugs or co-insurance, that could change. Sometimes your qualification requirements for what we call manufacturer's assistance programs by the manufacturers also change with time. So we don't have any control over what and when that changes, but someone from Veris will help you with those and be reaching out to you on these high cost drugs where people are already set up on those. Be sure we keep those going forward.
Hey, Bill, typically when we switch insurances, and we have those specialty drugs, there's normally like a period where it's getting denied and we have to have special approval. And so sometimes there's a couple months where you can't get your medicine because they're getting that all situated. Do we see that happening?
That's a good question. I would say, first of all, if there's anything that you can go get filled between now and April 1, go ahead and get it filled under the current providers. That will help. So that's number one. Number two will be, I would say if you are on a high cost drug, it wouldn't be a bad idea to reach out to Veris. And probably by the end of this week, they'll probably have the employees set up in their system. We've sent some of the files, but of course, if you're making changes on your plan, that won't be in there as far as who's covered, but just yet. But we've already sent, basically who's in the plan to them. So they're getting those set up this week. So pretty soon they'll be able to recognize that. So we're not enrolling this in the last week or something of the month. So that's helpful.
So are you finding that people that have high cost drug prescriptions are having trouble getting them through the existing plan because it's the last month of the policy period? I have somebody that's having trouble getting a prescription. Is that common?
I have not run into it at all. So if you'll get me that circumstance, we'll try to find out what's going on.
Okay. And then I've had a couple of requests already about whether this PowerPoint can be shared with staff members that need to talk to their spouses about it. They wanted to show them the information.
Yeah. Well,
Absolutely.
we've got this recording saved. So yeah.
Okay, great.
And Bill, I sent you the actual PowerPoint file. You can feel free to share and distribute that as well. That's
Okay.
completely fine.
All right. We'll do it. Okay. Anyone else?
I think we're good in Waco. Thank y'all for y'all's time today.
Thank you guys
Thank
very
you.
much. All right. Call us if you need help. Thank you.
Have a good one.
Thanks, y'all.
You.